Hi, welcome to another edition of Living Well with Dr. Brian Bansidhar. And today the doctor's with us and we're going to talk about colon cancer. Now, how important is the family history and the hereditary risk of colon cancer?
Well, that's probably the single most important risk factor that exists, and it's probably the least asked question on a day-to-day basis for most people. We stratify everything according to average risk, average this, average that, but the reality is that family history is a critical and oftentimes unasked question during the routine screening of people for any type of cancer, let alone colorectal cancer.
So tell me more about the family history. Is it close relatives, immediate family? How far does it go?
Well, it's pretty much any relative.
Okay.
Most people think about mom, dad, brother, sister, and then they stop right there.
Right.
The reality is that family history extends to any blood relative, because when you're looking at heredity, you're looking at your entire family, and you all share the same gene pool. And when you're looking at which family members are affected, it's anybody that's a blood relative, and you really need to look at every person individually. Got it.
Okay. So delve into the history just a little bit more. What does it really mean? What are the risk factors?
Well, risk in general, when most people think about colon cancer, think of age 50, screening colonoscopy, but that only accounts for probably 50 to 60% of the Americans. The other 40 to 50% actually have higher risk, but they don't know it. The family history is probably the cornerstone in determining what that risk might be, and that's why it's so important to determine what your family history really is.
So if the history is there, what's the next step?
Well, once you define the history, you need to look at what it looks like. And oftentimes it helps by putting it on a piece of paper, literally. When you see the history and you see the distribution of the cancers, if there's any out there, oftentimes it's shocking to people when they look at exactly how many people in total that were affected by this. Once you have that, then you determine what their risk might be. And there's certain characteristics that you look at, certain distribution, which family members were affected, how old were they when they were affected. That's a very big point. Although you don't have to get cancer at a young age, the majority of people with hereditary processes tend to get cancer less than 60 years of age. A lot of times, big red flags are somebody that was diagnosed with cancer at the age of 40 or 50. Unfortunately, if they passed away from cancer at a young age, no longer is that just bad luck. Now we know that oftentimes signifies something more, kind of like the tip of the iceberg, where you don't see everything else, but you have to delve under the water to see what it really means.
So in talking about treatment, is treatment any different if you do have a family history or maybe no family history?
Well, once you define what the family history is, if there's something tangible there where you suspect there could be a hereditary process, the screening protocols for patients in the family are significantly different than the average American. 50 is only appropriate for low risk, no other risk factors. Family history immediately changes that age to a significantly younger time frame. How frequently you're followed is significantly different than if you have no family history. And if you're identified as having a hereditary risk factor, a gene that causes cancer, the recommendations are dramatically different. Surgical intervention is oftentimes required prophylactically, meaning before you get cancer. It's not uncommon to recommend removing somebody's colon before the age of 50 because the risk of cancer is so high. It's not uncommon to do an annual colonoscopy on patients every year until such time as you identify a problem, or if they reach a point where they should have their colon removed because the risk is prohibitive. Several noteworthy media personnel have been diagnosed with similar processes, and it's actually helped bring about a lot of recognition to the fact that this does exist, and the way you're followed is dramatically different than the average American.
So, Doctor, if anyone has any further questions, they want to talk, they can contact you at your office on West Ridge Road. It's 4125 is the address. Mm-hmm. Call the number 833-1119.
Yes.
And get in touch with you, and you'll take it from there.
Yep. Recognition is half the battle.
Excellent. Thank you very much. Thanks for being here today.
Thanks
for another segment of Living Well with Dr. Brian Bansidhar.